The mistake that I see a lot of dentists make when they're polishing composite is they're going to run the disc and they're going to move it on and off of the composite. When you do that, what will happen is you'll get a scratch on the composite where you set the disc down, and then you get another scratch when you lift the disc up. So what I want to do is try and keep the disc on the composite surface and move the disc around the tooth, but keeping pressure, creating a little bit of flex with this coarse disc. Hello, I'm Dr. Dennis Hartlieb here with Dental Online Training with another in our video series for our clinical tips and product reviews for the restorative dentist. Today, we're going to review composite polishing discs. I love using discs for polishing composite. Today, we're going to be looking at the Flexi Disc system from Cosmedent. I want to show you how the disc system works and then how do you use them best when you're using discs to polish composite restorations. All right, let's get started. I'm going to switch on to my loupes and we're going to take a look at the tooth that we're going to be polishing today, and we're going to look at the disc and how we're going to use those. So I did a composite veneer on this tooth, on this dentiform. This tooth number 8 or 1-1 for our European and international dentists. You can see that it's a little bit long and it's a little bit bulky. So I'm going to be working with my disc to be able to do the contour that I want. And I want to show you how I did that. So I purposely made the veneer too big so that I could show you how I use the disc to contour and shape and polish. Now with the Flexi Disc system from Cosmedent, they have 4 different grits of discs and they come in 3 different sizes. Let me show you what we have. This is the starter kit from Cosmedent. If I open, you'll see that I have 4 different colors. There's a sand color, which is the coarse disc. The blue is the medium coarse. The yellow is the fine. And the pink is the superfine, or the last polisher. You'll see here that this is the FlexiDisc Mini. They actually has a regular FlexiDisc, but I think those are typically too large to use in the mouth in most locations. This is the 1/2 inch diameter disc, which is the medium size. We'll compare that to the 5/8, which is larger. You can see it has the same coloring system. The coarse is the sand color, then blue, yellow, and pink in that order. So those are the large discs. And then we have the mini disc, or the smallest size. And these are 3/8 of an inch. And again, the coarse, the blue, the yellow, and the pink in that order. So interestingly, for like a central incisor, like I'm going to be polishing today, contouring and polishing, I need all 4 of these discs. I need all 4 of the grits, and I need almost all these sizes. So it's important, I think, to have all these available, even on a central incisor where I need multiple discs, multiple grits, so that I can get the best contour and the best polish. All right, so let's get to work. So Cosmedent has a special mandrel for their discs. The mandrel is actually sort of a square shape. And you'll notice that when I place my disc, it sort of snaps in place. This is a nice feature because on some of the disc systems, they're just circular, the mandrel, and the disc can spin on the disc. In this case, they snap on, and so they maintain better, less likely to move around on the mandrel. Now with the coarse disc, I'm going to run these at around about 4,000 to 5,000 RPM, maybe up to 6,000 RPM, but these are fairly aggressive. Now, these are called Flexi Discs, and that's important because you want to understand that you need to be able to flex the disc over the composite. Generally speaking, I want to use as large of a disc as I possibly can over the surface. So in some areas, I need to use a very small disc because of where I'm working. In other areas, I'm going to be using a large disc. So here I'm going to start out with the 5/8, or the large size of the Flexi Disc. And I'm going to use this large disc for 2 purposes. One is to take off the gross excess of material off the facial, but also to adjust the incisal edge length. So first I'm going to start with the facial and removing some of that excess. And you'll notice I'm going to really flex the disc as it's working over the composite. The mistake that I see a lot of dentists make when they're polishing composites is they're going to run the disc and they're going to move it on and off of the composite. When you do that, what will happen is you'll get a scratch on the composite where you set the disc down, and then you get another scratch when you lift the disc up. So what I want to do is try and keep the disc on the composite surface and move the disc around the tooth, but keeping pressure, creating a little bit of flex with this coarse disc. Again, running this disc around 4,000 to 5,000 RPM. But creating this flex so I can get as much of that disc on the composite surface as I'm able. We'll look at that again, looking from the gingival as we get the disc and flexing the disc to get as much of that disc over the composite surface. All right, once you've gotten the facial contour completed, you should have a nice smooth surface free of any defects. Because when you go to the next phases, those defects are just going to get magnified. So if you have a defect at this point, a pit or something like that, you want to repair it right now while the composite is still coarse. If you want information on how to do a composite pit repair, check out one of our other mini tips where we show you how to handle those pits, make it seamless, and manage it while you already have all your materials out. But everything looks nice and smooth here. So once I've sort of brought in the contour, and of course I could use a high speed, I could be using like a carbide burr or a fine diamond burr to reduce the gross excess, but it also works with coarse disc as I just demonstrated. But one of the things that I absolutely want to use the coarse disc for is settling the incisal edge. So I'm going to show that now. You can see on my tooth model that I'm about 1 millimeter longer on tooth number 8 or 1-1 than I am on the contralateral central incisor. I want to reduce this incisal edge with my disc at about a 45-degree angle from palatal to facial. Now we're pretty close. We'll finish that up as we're working with our other discs, but that's using the coarse disc to start getting the gross excess material removed and bringing in the contour. So then we can use our medium coarse disc, the blue disc, to finish the contour before we go into the polishing phases. All right, so let's go ahead and do that. We're going to pull out the blue disc and then we're going to start working on that aspect of shaping and contouring. With the coarse disc, it's very easy to tell which is the grit side of the disc and which is the non-working side. If we look at the coarse disc, you'll see that the paper is pretty obvious on the one side versus where the grit is that we're using for the contouring. Now, when we work with the other discs, it's going to be a little bit harder to tell because they have mylar backing. So the way you tell which is the polishing or the working part of the disc is the working part of the disc has this brass center area right in here. Whereas if you flip it over, the non-working area is where the brass is folded over. So this is not the part that you use. Easy to tell with the coarse disc, but for instance, when we go into using the pink disc, which has a mylar backing, the polishing side, this is the non-polishing side, you can see where the rivet is folded over. Versus the circular area, this is the working side of the disc, where it's round and the brass fitting is round, and where the disc has a little bit of grit. So a little bit harder to tell with these other discs. All right, we're going to move on now. We're going to be using our final contouring disc. That's the blue disc. My favorite blue disc to use is a small blue disc, and we're going to use the small blue discs to help open the facial embrasures. When I use these blue discs, I'm going to use the polishing part or the working part towards the handpiece. And the non-working part, where the brass is folded over, is away. This is also a nice thing about the Flexi Disc system. There's only one polishing surface on there. Some of the polishing discs are on both surfaces, and if you're working on neighboring teeth that have composite, you can inadvertently be polishing the other tooth. This is nice where it's only single surfaced, and you can just simply flip the disc over to get the polishing area that you want. So with the blue disc, I'm going to run these a little faster than the coarse disc. I'll run them around probably 8,000 to 10,000 RPM, and I'm going to work in a proximal Avoid getting through the contact, but helping to open around the facial embrasures. Again, with these discs, I want to get a lot of flex on the disc. That's how we impart that smooth surface onto the composite. And where you see that little white spot there, that's where there's a little defect where the composite's not totally honed down and nice and smooth. So we'll just continue to work with our disc, creating flex and rolling open that facial embrasure on the distal, and then through the incisal. We'll do the same thing on the mesial. I'm going to replace my small disc. I'm going to place another small disc. And this time I'm going to have the working side away from my handpiece. So now you can see the polishing portion is away from my handpiece, and I'm going to be rolling in that facial embrasure and even through the incisal. You can see how we can start softening the contour by using these discs. I love these discs for rolling in those facial embrasures. I think they're absolutely critical for that. We can also use these discs around the cervical. In the mouth, I would use a retracting instrument to protect the soft tissue. I'm holding the model with my left hand, so I can't do that, but you might imagine I'm supporting the soft tissue, and I can use these small discs, these 3/8 inch discs, and I can work right around the cervical margin. And hone those in. But again, with a retracting instrument to pull the tissue back. Obviously, polishing cups work in those situations also, but the disc can do a really nice job of honing down that composite, I think better even than what the rubber can. When I'm done with the small blue disc, then I'm going to go to the medium-sized blue disc. This is the 1/2 inch blue disc, and I'm going to use that over the cervical half of the tooth. That's going to give me a nice smooth surface. It's sort of like a pre-polish. So again, there should be no defects when I'm done with this part. I'm going to be running this disc about 8 to 10,000 RPM. I want to see plenty of flex on this disc as I'm working the disc over the cervical half of the tooth. So it's going to look like this as the disc is rotating, and I want to keep the disc on the tooth. I don't want to be lifting it up and scratching the composite. So it's going to look something like this. And you'll start to see how we're getting a sort of a beginning of a gloss, still a little bit of a matte finish, but really starting to get a nice surface just at our still contouring disc. This is our medium coarse, still a contouring disc. Now, over the full facial, I need a larger disc. I want to use the largest disc that I can. So I'm going to go to the 5/8 inch disc. You can see the gloss that's coming off of that. Just with the blue disc, or medium coarse disc, we haven't even gotten to the polishing disc yet. I can also use a blue disc to help refine the incisal. And I can roll back the incisal facial third. Again, using this blue disc and getting flex into the disc. Looking something like that. If I need to, I can go back to the coarse disc and do a little bit more adjusting on the incisal edge. Rolling in any contour, but be careful with your coarse disc. They're going to be aggressive. And again, going back with my small blue disc and opening up that facial embrasure and the incisal embrasure. So that's going through the contouring disc, the coarse and the medium coarse, the sand color and the blue color. Once we have finished with the blue disc especially, there should be no defects on the surface. That would again be time to go back and do the pit repair. Everything looks nice and smooth. Let me dry that off. And we have a nice smooth surface, matte finish with just a tiny bit of gloss starting. Now we can go to our polishing disc. I'll use the yellow disc first, our fine disc. I'll use it in the same format that I used the blue disc. I'm going to use the extra small, the 3/8 inch disc, Flexi Disc. I'm going to run this a little bit faster though. I'm going to run this around 12 to 15,000 RPM. Working into the proximal. Can use it to work around the cervical like I did with the blue disc. I'll follow up the same way I did with the blue disc. I'm going to use a medium yellow disc for the cervical half of the tooth. You start to see the shine start to come out now. See the gloss. And then I'll go to the large yellow disc. The disc is going to be facing away from me. Again, get as much flex on that disc. Going to run it around 12 to 15,000 RPM. And that's the type of gloss you're going to get, and we haven't gotten to the final polishing yet. For the final polishing, I'm going to use the pink disc system, exactly the same way I do with the yellow. I'll start out with the extra small, the 3/8, working into those facial embrasures, through the incisal edge. We then move to the medium size of the pink disc. This is the 1/2 inch. Again, the polishing surface is towards the handpiece. I'm going to flex it over the cervical half of the tooth. Run this around 12 to 15,000 RPM. All right, I'm going to finish with my large pink disc, and then I want to get as much of the disc onto the composite as possible, running this around 15,000 RPM. Lots of flex. All right, so there's our polished composite using the Flexi Disc system. There would be one more step clinically. I would be using a polishing paste to do the final polish. We'll be covering composite polishing paste in a different video for your product review, but this is how we use this Flexi Disc system. You can see even without a polishing paste, you can see the gloss and the shine that's on the tooth. Free of defects, free of scratches, nice smooth surface, and that's how we use our Flexi Disc system. I hope you enjoyed this product review. Again, this was the Flexi Disc system from Cosmedent. This is the technique that I use to be able to get just a beautiful gloss and shine and smooth surface without defects using the system. Okay, I hope you enjoyed this tip. If you enjoyed it, check out our other clinical tips and product reviews from Dental Online Training. Until next time, yours for better dentistry. I'm Dr. Dennis Hartlieb.